Okay, you can start to get an idea of the myriad of different clinical situations that we face while we're teaching our residents here every year. And that was a problem of missing teeth. There's also the opposite problem. Alexia is going to teach us a little bit about that with her clinical case.
Let me see if I can get more brightness. Yes, pointer's over here. Good luck.
Well, I planned to say good morning, but it's almost noon, and I know that you all want to have lunch, so let's make it fast. My name is Alexia Trifonidou, and I come from Cyprus. And I would like to share a small video about my country with you. Cyprus is the third largest island of the Mediterranean and is located on the eastern part of the Mediterranean Sea. According to a Greek myth, Aphrodite, the Greek goddess of beauty and love, was born in Cyprus. And because of his position in the sea, it has been occupied through the years by several major powers. One of the last were the British, until the island was granted independence in 1960. In 1974, the northern part of the island was invaded by the Turks and is being occupied since then. And our political situation, it's a matter of ongoing dispute for the last 38 years. Cyprus is one of the most popular destinations in the Mediterranean Sea because of a variety of attractions that offers, as you can see. And tourism is our main source of income. And as you all know, lately the oil and gas exploration, they seem very promising for our economy. My hometown, Limassol, is situated on the south part of the island. It's the second largest city of Cyprus, and it offers a combination of attractions. It's a city of more than 2,000 years old. It offers culture, traditions, a great nightlife, ancient monuments, and great beaches. And during the last years, Limassol has experienced a construction boom fueled by the tourist sector, as well as from increasing foreign investments in the city. It is the biggest industrial center of Cyprus and also has the biggest port of the island. This is the new marina we just constructed. Limassol also hosts the annual carnival, which actually will take place in next month. And also in September, tomorrow, slicha. And in September, we have the wine festival. This is the new marina, which is built next to the old town. And generally, it's a city which constantly changes. Okay. The case I will present today was under the supervision of Professor Shapira, and it's about a 12-year-old boy who was referred to our department because he was referred by his dentist because he was missing his upper left central incisor. The patient has a symmetric face, an orthognathic convex profile with a tendency to fullness. His upper midline is onto the face, and the lower midline deviates only 1 millimeter to the left in relation to the upper. One of the initial diagnostic procedures that we follow was to take a panoramic X-ray, and as you can see, Nathaniel is not congenitally missing his upper left central incisor, but the tooth is impacted meaning that something prevents that tooth from coming into the mouth. And in this case, it was prevented by a supernumerary tooth, and also the patient has an additional supernumerary tooth on the upper right side. From the periapicals, the impacted tooth was identified on the palatal side, on the buccal side, and the supernumerary teeth were identified on the palatal side. Now, what we mean when we say a supernumerary tooth? Supernumerary teeth, we refer to those teeth that are additional to the normal developmental number. The most common case in orthodontics is to have 1 or 2 supernumerary teeth, which are mainly on the anterior maxillary area, and they have a conical shape or are incisor form morphology. But sometimes things get more complicated, that you actually can lose count, like in the congenitally cases of cleft lip and palate patients, and also of cleidocranial dysplasia. The incidence in the population in the permanent dentition is 1.5 to 3.5%, which is rare, with a male to female ratio of 2 to 1. When we have a supernumerary tooth, that can cause a lot of problems, like displacement of the adjacent teeth, resorption of the adjacent teeth, cyst formation, and also, like it was in our case, it can prevent the eruption of a permanent tooth. So, Nathaniel had a negative history of trauma in the past and no familiar malocclusion in the family. Clinically, you can see that he's obviously missing his left central incisor. The left-right central incisor it's in a dead-at-dead relationship with the opposing teeth. The lateral incisor is in a crossbite. The canine is erupting buccally, and also the lateral incisor is in an open bite with the opposing teeth. In the maxillary arch, on the right side, we have moderate crowding, mainly because of this tooth that we need to put it into the arch. And on the left side here, you can see an extraction space of the first molar that was extracted because of caries. In the lower arch, we have only minor crowding. Our problem list was, first of all, the 2 supernumerary teeth at the upper incisor area, the maxillary left central incisor which was impacted, the moderate crowding on the upper right side, the space on the upper left side, the anterior open bite, and the cross bites. So the treatment plan that was chosen for Nathaniel was to prepare enough space for the impacted maxillary left central incisor, proceed to the surgical extraction of the supernumerary teeth, bring the impacted tooth into the arch, extract the upper right first premolar, and bring the canine into the arch, and also close the upper left space by bringing the molar forward, and also achieving a better overbite and overjet for the patient. So after we bonded the upper arch and we got some leveling and we achieved some space for the impacted tooth, we moved to the surgical part of our treatment. A full flap was raised and the supernumerary teeth were exposed. You can see the 2 supernumerary teeth that we found on the palatal side, that they were extracted, and afterwards the impacted tooth was exposed and an eyelet was bonded on the labial surface of the tooth with a ligature pigtail, and the flap was closed. The activation started by tying every time the ligature into our main arch wire, and 7 months afterwards, you can see that the tooth was in appeared into the mouth. Afterwards, we put the previously impacted central into our main arch wire and started to get it leveled with the rest of the teeth. At one point, our patient needed to wear intermaxillary elastics because we wanted to bring the upper teeth more forward and the lower teeth more backward and correct his anteroposterior occlusal relationship. And also, with the use of these elastics, we managed to close the space that we have from the previous extraction. So for every appointment, the occlusion was improving. We needed a lot of cooperation with the patient. And there was a point that we needed to correct the torque of this previously impacted central incisor. So we used a torquing spring. The aim by using this torquing spring was to move the root of the central incisor palatally and the crown backally. And this was achieved by a force that was exerted by the torquing spring, by the curved part of the torquing spring on the tooth. That torquing spring was placed on a rectangular wire. The torque was improving. We also got some progress X-rays, and we started correcting root inclinations that they were needed. And every appointment, it was much better than the previous one. The case is not finished yet, but we are very close. This is the before and after up to now. We have also some minor things to do in order to get the case perfect. But the patient is satisfied. We achieved all our treatment goals, and I think it will finish soon. First of all, I would like to thank Professor Shabira for being the clinical instructor of the case, to thank all of my instructors. Personally, I've learned from all of you, and I really appreciate your hard work and your expertise. I would like to thank my PNG friends, PNG6, my Elias, my senior, Elias, for all his help and his support. My junior, where is my junior? Thank you. My PNG7 family, my sisters and my brother, Nuno, for all the help and for all the moments that we shared, and for all the strength that you have given me on these hard times of these 3.5 years. And last but not least, I would like to thank my parents, the two most important people in my life. I wouldn't achieve anything without them. They were always by my side, and they just made everything seem possible and be possible. I really appreciate and I recognize their sacrifices. And I want to give them a promise that I will do my best in the future, as always. And I hope I will make them proud. Thank you.